All right, Dr. Malani, we are live. So good to have you here today. I've already enjoyed talking to you already. I mean, I could literally just go and drink my coffee today because I've had such a good talk with you already. How are you doing today?
Great. I'm so excited to be here. I find that this platform has provided so much amazing education. And so I hope to be able to add to a little bit of that today. But thank you for having me.
Oh, I'm sure it will, you will. I mentioned in the post, right? Integrative oncology, it's one of my favorite topics. I just love everything about it, having benefited from it myself. So before we get into all the questions, I want to ask you to introduce yourself and just give us a little bit of a high level who you are.
Yeah. So I'm Dr. Sonia Malani. I'm a naturopathic physician who is board certified in integrative oncology. What that means is that I did additional training after medical school, residency and fellowship to learn integrative oncology. Integrative oncology really is this field of combining integrative medicine alongside conventional standards of care. So chemo, surgery, radiation, hormone therapy, immunotherapy. And the goal and intention of integrative oncology really is to focus on the patient, on the quality of life of the patient, and try to decrease side effects while a patient's going through treatment. You and I spoke about this a little bit before, but we're so focused on reduction of the disease, right? Get rid of the tumor, whether that's through radiation or surgery or chemotherapy, but we sometimes forget the human that is experiencing the disease. And so I think integrative oncology really is a specialty that comes in and helps fill the gap for patients who are feeling lost and confused, and also who are done with treatment and don't know where to turn.
Yes, yes. That piece right there, the done with treatment piece. I remember the integrative oncologist that I went to. She said, when we're done with treatment, she herself was a survivor as well. And she said, when we're done with treatment, we don't know what to do. Because during treatment, at least you feel like there's something happening. You're getting chemo, you're getting radiation. So you feel like your cancer is being taken care of, and then you're done. And
Right.
then what? Now all of the crazy thoughts start to happen.
Right.
So I'm glad you mentioned that. You also said before we got on here, which I thought was interesting. You said, which I didn't know. You said integrative oncology is a subset of integrative medicine. Can you explain a little bit more what that means or what it looks like? Yeah.
So integrative medicine is kind of the umbrella term for modalities like diet, supplements, lifestyle, looking at nutrition, looking at various natural medicines that can complement conventional therapies. And what integrative oncologists really do is, first, we're introduced to the field of integrative medicine, things like yoga, acupuncture, diet, nutrition. And then we learn and start studying how can we apply those modalities to cancer patients and to cancer survivors. One of the things that you just said that it reminded me of is a lot of my patients, I find that once they're diagnosed, they kind of feel like they're on this cancer conveyor belt. That's how I describe it. It's like, as soon as you get this diagnosis, you're put on one treat. You go from one appointment to one, the next scan to the next image to the next infusion. And you never really get an opportunity to step off of the conveyor belt during treatment. And so the other aspect of integrative oncology is I tell my patients, hey, let's use our visits to step off the conveyor belt, look around, make the most informed decision, and then hop back on. Because then it gives patients a space to breathe and just say, okay, I know what's going on. I'm going to make an evidence-based decision to go back on the conveyor belt, and I'm going to do it in a way that my quality of life is preserved.
I am going to have to stop us for a quick second because I noticed that I don't see my folks in the feed. So it showed me there was something. We're broadcasting on Facebook as well as YouTube, but I didn't see us on. For some reason, we lost the feed. Not us, but LinkedIn did not, for some reason, have this feed. So I'm going to hit that, and I'm going to see if I can see us on LinkedIn now, because I knew there was something wrong. I always have some people who are here like first thing, so I'm like, wait a second. So I knew there was something totally off. So let me see if I can see us. And then if we do, we're going to have to, we may have to start over.
Okay, no problem.
That's going to be okay with you, because
Yeah.
I think it's important to be on LinkedIn. LinkedIn is where we get the thousands of views. So now I see. Okay. All right. So we just got live on LinkedIn. So, all right, Facebook and YouTube, I'm sorry, but we're going to have to start over, because LinkedIn is kind of like where we have a lot of our views. So I am going to hit this button again. And so, technical tech issues, we can't always control it.
It happens. It's part of letting go, right?
Yes, it really is. I'm like, wait a second, I don't see certain people in the feed who's always here. So, all right, Dr. Malani, again, sorry, apologies for Facebook and YouTube, but I wanted you to start again because we weren't coming on LinkedIn. Introduce yourself again real quick, who you are. You were doing a great job too. I was like leaned in, but sorry, we're going to start again.
No, that's okay. Well, first off, thank you again for having me. So my name is Dr. Sonia Malani. I'm a naturopathic oncologist. What that means is that I went to naturopathic medical school. I'm a naturopathic doctor. And then I did additional training in integrative oncology to serve our cancer patient population. So I specialize in integrative oncology, everything from diet, lifestyle, herbs, supplements, nutrition, exercise to complement conventional cancer treatment. So chemo, surgery, radiation, immunotherapy, hormone therapy. My goal as a physician is to increase the quality of life of my patients, decrease their side effects, and support them after they're done with treatment. That was a very quick version.
And so let me remind you about what you had said, of course, already. You had mentioned that I actually asked you, you said that integrative oncology was a subset of integrative medicine itself. And you were explaining to us what integrative medicine, what the bigger umbrella was.
Right. Yeah. So integrative medicine really is the umbrella field of looking at what medicine can really enhance conventional treatment, conventional therapies, so pharmaceuticals, things like that. The field of integrative medicine, the range is everything from yoga, acupuncture, nutritional consults, diet, lifestyle recommendations, exercise prescriptions, art, music therapy, and what integrative oncologists really do is we study integrative medicine, but for the cancer population. Mm-hmm. So, many integrative medicine docs are very well versed in supplements or vitamins and minerals and various nutraceuticals. But what integrative oncologists have done is they've studied how those nutraceuticals, or phytomedicines, as I like to call them, plant medicines, could impact potentially chemo or radiation. So there's a little bit of nuance to integrative oncology that our folks in integrative medicine don't necessarily study unless they're working with the cancer population. So that's kind of how I would describe it.
Okay, and we talked about this before we got on here, but what got you into this field? You said it's an extra step after you've done your regular, studies. What got you into integrative medicine?
Yeah. So, cancer, I was never one of those people that wanted to be a doctor. My father was an MD. I saw his hours. I saw his work schedule. It was not appealing to me. But cancer kept coming up in my life. So when I was 6 years old, my mom was diagnosed with stage 3 breast cancer. I saw her from age 6 to 8, maybe 6 to 9, really, go through chemotherapy, go through surgery, go through complications from surgery, go through complications from hormone therapy. And I was in and out of the doctor's office my entire childhood. When I was 19, my father, who was a medical doctor, was diagnosed with stage 4 gastric cancer. And by the time they caught his cancer, it had spread. His prognosis was 3 months. And it was really actually my dad's journey that led me to where I am, because he started looking a little bit outside of the box. He knew what his options were. He knew what the prognosis was going to be. And he really wanted to preserve quality of life for the time that he had left. He used a lot of integrative medicine, and that's how I found out about integrative oncology. He ended up making it 15 months. and with an amazing quality of life, really. He was able to travel, he was able to go back to work. And so I saw the power of this modality really early. And pretty quickly, like switched my major within 24 hours, went back to college, started doing pre-med, and then, here I am after more than a decade of training. But I think when you're a caregiver, you really kind of feel helpless. And there's so much out there on the internet too, of when it comes to you're kind of given this stamp on your forehead of cancer. And then this whole world opens up, right? It's like your nephew's uncle's aunt is coming over and saying, oh, you should try this herb, or did you see the trial out in, California? And there's all these people there's all this information that's coming at you, and it's really hard to sort. So part of my motivation was to be in a position where I don't feel helpless again.
Yeah.
Really kind of be gather the information myself and go through the training so I don't feel helpless. And then also make sure more people know about this. I mean, I firsthand not only saw it in my parents, but have seen it now in thousands of patients of how impactful integrative oncology can be before, during, and after treatment.
Yeah.
And so really, I would love to see, I said this to you earlier, but my goal in my lifetime is to be able to see integrative oncology become the standard of care. And I think I feel really optimistic about that. Every time I feel like I talk with another colleague, it's more and more people are open to it.
I agree. I agree. And it is different from alternative medicine, which I know on a cancer journey, some people, because of the quality of life issues, they'll say no to traditional cancer treatments. They want to do, just strictly diet, and nutrition and yoga and all the other stuff. But that's not what integrative oncology is, right? So can you tell us the difference between an alternative medicine, where, hey, I'm going to do alternative medicine, or I am going to include integrative oncology in my care?
I think the easiest way to sum up is alternative medicine is an alternative to conventional. Integrative medicine is complementary to conventional. So it's complementary to what you are currently doing. And the other thing too is integrative medicine is evidence informed. That's a big part of the definition that I left out earlier. But the recommendations that we are prescribing to patients are backed in good evidence. Part of that evidence informed thought process is also not taking the science that we have and then taking the patient's preference into account. And so what integrative oncologists are able to do is have a long conversation with our patients. Right now, an average medical oncology visit is about 23 minutes, and an average integrative oncology visit is anywhere between 45 to 60 minutes. So we have the time with our patients to learn their goals and also deliver the information of what is evidence-based and what potentially could help them. I think a lot of what I do actually is, I kind of call it harm reduction. I spend many of my visits with patients just doing what I consider harm reduction, which is I will ask them to bring in their list of questions or the list of supplements that they've been recommended or the things that they've looked up online, and we'll go through the list question by question in terms of what maybe they shouldn't do. I think it's equally important patients know what integrative oncology is as important as they know what it is not, right? It's not It's not these juice cleanses. It's not a maple syrup and baking soda. It's not stuff, it's evidence-informed medicine that can complement your conventional cancer treatment.
Can you get a little bit more granular for us? Because you're right. What it's not maple syrup. It's not, it's not all the things that we hear from our different cultures. I was laughing with you earlier about, the things that us Jamaicans talk about, right? Which is more on the alternative medicine side. But tell, just from your experience, how has, your work with patients as an integrative oncologist, how is that? How effective is it? So if you're going to sell that idea to someone who doesn't know about it, right? How would you, what would you give as an example? Like, hey, when I did this, or when this patient did this and this, especially patients, its impact on patients going through chemotherapy and radiation, like those treatments, which are those terrible side effects.
Right. So let's talk breast cancer. That's a very common cancer, and many of us have someone in our life that has been affected by breast cancer. So we'll take a kind of a textbook case of breast cancer. So the most common treatment regimen is to give chemotherapy, usually drugs that are called adriamycin, Cytoxan, and Taxol. That's kind of the most common drug regimen. And then you maybe do surgery, then you maybe do radiation, depending on the extent of the tumor, if there's any lymph node involvement, some other various factors. But during chemotherapy, what we can do is help minimize some of those side effects. So we know that there's some GI side effects, there may be some neuropathy, there's going to be some hair loss, there's going to be anxiety and depression, which can very easily not be missed and not diagnosed if you don't have enough time to speak with your provider about what's going on. There can be insomnia. Sometimes you're preloaded, your chemotherapy is preloaded with steroids, and that can really affect your sleep and your energy. There can be loss of appetite. So what we'll do is we'll talk to a patient and say, okay, during treatment, if a patient's coming to you and they've already started treatment, then we'll say, all right, how are you doing? How are you feeling? We'll go through some of the most common side effects. And then if they are experiencing maybe severe constipation, we'll add something like magnesium or help them come up with a bowel regimen in order for them to be able to go through chemotherapy infusions without having constipation. Or cancer-related fatigue is another big one. We know acupuncture can be incredibly effective for that. So we'll go through what their side effects are. If they are experiencing a lot of fatigue, we'll refer them to acupuncture. And what we'll be doing is they'll be maybe seeing their acupuncturist every week, but they'll see us every 3 or 4 weeks to kind of check in and say, okay, let's prescribe another 4 sessions of acupuncture, or let's add in another therapy. Let's add in some yoga or massage, or let's add in this supplement. So the integrative oncologist is kind of working around and working alongside the medical oncology team to bolster our patient. That's really how I think about it. Is the medical oncologist and radiation oncologists and surgical oncologists are the big guns. They're the ones that are really reducing the tumor burden, but we're the ones that are trying to build the patient back up while the tumor is being reduced.
You mentioned like an acupuncturist, right? So you as integrative oncologist, you're working with oncologists, like you said, the medical oncologists, the acupuncturists. Are you working with nutritionists as well? And
absolutely, yeah. So most integrative oncology departments, what I've seen is the services that they have are yoga, acupuncture, massage therapy, some form of art therapy like music or narrative medicine. Or even just, actual art therapy, drawing or painting or something like that. And then they kind of have this integrative oncologist that is the quarterback. That's like, all right, you're going to go to see the integrative oncologist and they're going to tell you which modalities to use. But yes, nutrition is involved in that. Dietitians, yes. But not every patient needs everything.
Right.
Which is also really important. I think one thing that comes up a lot in integrative oncology is sometimes what we do is patients will come in on laundry lists of supplements, and I will take them down from 10 to 1. Less is more with supplements.
Yes.
Just as a bottom line, in my opinion. But
yes.
They'll leave and they'll say, well, Dr. Malani, you took me down to 1 supplement, but are you sure we're doing enough? And I think what's really important is have that conversation with the patient. Yes, by sleeping every night, by exercising, by hydrating, by taking this 1 supplement that we know has some evidence that it works alongside your chemotherapy, and by having social support and joy in your life. All of those things are medicine. We have been so accustomed, especially in this country, to think that the solution is outside of us and it's some pill, it's some, it's some sort of tangible, but our lifestyle can be medicinal.
I've been listening to this woman recently. Her name is Dr. Mindy. I don't know if you've ever heard of her. She's like a fasting. Her big thing is fasting, right? So she's been talking a lot about what you just said, that a lot of the solution is within us. What role, if any, does fasting play in that whole process of self-healing? Is it something that you as an integrative oncologist, do you recommend that at all? Whether it's intermittent fasting or regular fasting?
Yeah, so there are various types of fasting that can be helpful depending on where you are in your cancer journey. A easy example is, again, going back to breast cancer. We do have some data that shows that intermittent fasting for 13 hours overnight can reduce the risk of recurrence of breast cancer. 13 hours basically means moving up your dinner a little bit and then waiting 13 hours to break your fast for breakfast, right? Breakfast is break fast. So
Right.
it's called intermittent fasting, but it's really just the time you're sleeping, right?
Right.
And we know something as simple as just not eating too late before bed can be helpful. And I think there's a number of different factors there. It's very rare that you'll find someone grab a healthy snack before bed. I rarely hear from patients that they go and grab celery before bed or some carrots. So we tend to
Right.
go for the more carby things before bed. That has a little bit to do with our cortisol and levels and things like that. But we tend to eat more carbohydrate heavy foods before bed. And if you're snacking up until you go to sleep, you're also not allowing your digestive system to have a break. So
Mhm.
counseling, women that have breast cancer of just moving their dinner up, if they can finish dinner by 7 and then waiting that full 13 hours, they can drink water, they can drink their herbal tea, they can drink black coffee during that period, but then waiting until 8 a.m., 13 hours later to break their fast. And I think that's probably the number one fasting that I do during treatment or after treatment. I'm not a huge proponent of long fast during treatment because treatment is really depleting and fasting
Right.
is depleting. So
Right.
again, I want to build my patients back up once they're done with treatment. And then we could talk about fasting for a variety of reasons, whether it's healing some digestive issues or working on energy or working on regulating the immune system. I do think fasting has a role, but it does need to have medical oversight.
Yeah, I've heard that, and that's a really common theme now. Like the oversight is important. I'm going to take a couple of questions.
Yeah.
What are the major integrative oncology conferences, and are these patient facing?
Yeah. So there's 3 organizations that I think are really kind of leading the way with integrative oncology. IOWG, Integrative Oncology Working Group, is something run by a doctor named Manoj Reddy. He's a radiation oncologist based in Dallas. He started this organization to really help MDs, PhDs, NDs, all of us kind of get together and figure out how we can serve our patients best. Right now, there's not an annual conference, but I think hopefully that will be coming in the future. Hint, hint, Manoj, if you're listening to this. But then SIO, Society of Integrative Oncology, and OncA&P, the Oncology Association of Naturopathic Physicians, and we can maybe put that in the chat or something.
Mhm.
Those are 2 organizations that do have annual conferences. They are patient-facing. They're also provider-facing. But what I like about both those conferences is that they have kind of breakout sessions where patients can have a little bit more interaction with some of the docs there, and get the information firsthand. But those 2 are definitely where I see the most information being presented each year. ASCO also does have their annual conference each year, and they do have more and more. We're starting to see that they are setting time aside to talk about integrative oncology updates.
Awesome. Okay, next quick question. What do you think the uptake accessibility has been for integrative oncology in underserved population? We talked about that before we got on here, but what you're seeing in, first of all, we talked about the fact that integrative oncology is still not very popular, that there are still many, many facilities who don't even mention it.
Right.
And you're saying it's even worse in underserved populations.
That's been my experience. So, I practiced on the West Coast for a number of years, and the West Coast is quite saturated. Integrative oncology is kind of like Starbucks. It's on every corner there. But when you move into the middle of the country, we're really largely underserved. And it's, I did actually do some research recently. There are right now 55 NCI designated comprehensive cancer centers in the United States. And 40 of them actually do have some integrative medicine
That's good.
resources. So that is really optimistic. But key caveat there, they have integrative medicine resources, not necessarily integrative oncology. So I think what we're seeing is really a push for every cancer center, specifically the ones that are NCI designated, to start building on these integrative oncology services. And, it's interesting because I'm right now kind of brainstorming with a group on how to do this. And our biggest issue that we're running into really is, how do we provide these services in a way that is accessible from a financial perspective, in a way that it serves the patients, if we can do it at no cost or low cost, but in a way that also keeps the hospital or the clinic up and running, right? So there's still not full insurance coverage for all integrative oncology services. And I think that is a rate limiting step. I think that's where we really need to see some improvement. And I really hope in the next 5-10 years that will change. That's something that I really have been working and advocating for. And as insurance changes, as insurance coverage increases, I think we'll see accessibility increase. So insurance has been a struggle lately.
Yeah. I've heard some of those horror stories. Well, one of the things I'd mentioned to you, Dr. Malani, was that when I saw my integrative oncologist, I saw her virtual the entire time because it was during COVID. It made no difference to me that it wasn't in person. I had the option of going in. I never took it because I didn't feel like it was necessary because I just wanted the information. So as you were talking about, how can you get this more affordable and more accessible? I'm just thinking, technology.
Yeah.
And lower overhead. You don't need all this office space because what people need when they're diagnosed is that information. And they want to be able to check with you too. Like you're saying, there's so much information online on Google and everywhere else. We talked about Herb's website. We need good sources of information. And so as you are brainstorming with that group, be thinking about that. Okay, let me just jump in here. Sarah, and I don't know if you know Sarah. Sarah is our founder here at Total Health. Okay, so Dr. Malani has such a kind way about her, full of knowledge, and would make patients feel confident. I love that you use this less is more approach. Like you said, if they're on 10 supplements, you could probably get them down to 1 because people think that more means more recovery, but it doesn't necessarily mean that. Are we studying?
Oh, I was just going to say a sentence that I say quite often to my patients is, instead of the medicine of addition, can we practice the medicine of subtraction, right?
Yeah.
We want to keep adding, whether it's, a dietary change or another supplement or even additional medications. But instead of adding a stress, like for example, if you're undergoing a lot of chronic stress, instead of adding a adrenal support that we know could maybe help your adrenal glands and manage the stress, can we eliminate the stress? Can we subtract the stress?
Right.
Or instead of adding, a sleep aid, can we subtract the fact that you're being woken up in the middle of the night because your partner keeps tossing and turning, right? Like,
right.
Can we really figure out what is going on in your life and personalize our treatment to truly your day-to-day? Not everyone is the same. And
I love that. In your practice, I love that approach. It's so customized. In your practice, is that what you're able to do? To say, okay, let me look at you, Sharon Gill, the patient, and what you're going through. And like you said, it's not always a pill solution. It may be a lifestyle change or a diet change or an exercise addition or whatever else it may be. Is that what?
Absolutely. So, I think my patients probably think I'm funny, but I always, at some point in our conversation, I always will say, like, take me through your day-to-day. I want to know what time you wake up. I want to know what is the first thing you grab? Do you grab for a cup of coffee? Do you grab for a glass of hot water with lemon? Tell me what you're doing. Do you check your email immediately? Like, take me through your kind of lifestyle habits so we can see the leverage points.
Right.
If you're having, for example, if you're waking up and grabbing a breakfast bar and then you're crashing every day at 12 o'clock, well, maybe you're having a huge blood sugar spike with that breakfast bar, and that's why you're causing the crash. So instead of adding caffeine, can we just modulate your breakfast? Can we add more protein so that you have a stable blood sugar spike so that you don't crash at 12? You don't need the additional caffeine. So really trying to think through what their day-to-day is, I find an incredibly helpful strategy because then you're also giving medicine, you're delivering treatment recommendations that the patients are going to be compliant to. I find so many times, and I've experienced this too. I mean, every doctor is a patient at some point, but I've left visits with, various providers before being like, I don't actually think I can do what they told me. Like, I don't think I can take that, or I don't think I can eliminate that food. And when you leave with that feeling, you don't really know where to go. You kind of feel defeated. So I think I always check in at the end of my appointments. Hey, is what we talked about obtainable? Is it adding more stress to your plate? Because again, I mean, stress is inflammatory. I don't want to add stress to my patient's plate when I'm actively trying to eliminate it, right? So if I give them 10 things to do and they're leaving and, they're wheels are turning of how am I going to do what Dr. Malani just said, that to me is not therapeutic.
Right. I agree. All right. Some more questions. Are we studying enough about the way different people groups respond to integrative interventions, culturally, biologically, spiritually?
Yeah. So when I'm not seeing patients, I am actively involved in clinical trials. I do a lot of research myself. I look at prospective outcome studies, or I help run prospective outcome studies to really see whether using integrative oncology alongside standard of care is improving quality of life, decreasing side effects, and improving overall survival. That's kind of the question mark that we still don't know yet that we'd like to add.
Yes.
We'd like to add to that level of evidence. So what I will say though is, having been in the research world, funding is difficult, and getting the resources to be able to really research across socioeconomic status, across populations, across different demographics can definitely be another obstacle. So are we studying enough? I don't think we'll ever be studying enough, but I do think that there is, there are some groups that are really kind of being proactive and really trying to be creative with studying these different, the different cultural aspects and how that can affect one's outcome or affect one's quality of life. And I think those things are really important. One thing that, I've been recently learning a lot more about is how our kind of ancestry can affect our microbiome, right? Like the way that if you've immigrated to the US and you're used to a different diet, your microbiome is usually accustomed to that diet. And when you change to the standard American diet, we can have a lot of health issues, right? So thinking about even just something as simple as that, culturally, are we paying attention to our patients' histories and where they came from and their orientation to life?
That's so interesting. That's very interesting. Never thought of it that way, but it's true. I mean, I was just thinking to myself, yeah, in Jamaica, I ate a certain way, which, a lot of it was just off the land.
Right.
A lot of it was fresh. A lot of it was in a backyard or, at the market. And here it's a lot more packaged,
Yes.
So it's very true.
And then you're bombarded with all this evidence of, don't eat this dairy or don't eat this gluten or don't, and it's like, well, or, whatever it is, don't eat beans. And it's like, well, maybe you grew up on beans. So we should think about that, right? Like maybe your body is used to that source of nutrition. Yes. So it's hard when there is so much noise right now. I mean, I think we're at an all-time high with the amount of information we have access to.
And that makes it so hard. It goes back to that whole trust thing again, right? Because there's so much information out there. Who do you believe, right? Who do you believe? A couple more questions and then we'll kind of go to closing. But are there established guidelines for integrative oncology, and do organizations like ASCO or NCCN offer any evidence-based treatment recommendations?
Yes. And this is what I'm so grateful that we have. So ASCO has partnered with SIO, Society of Integrative Oncology. They have published quite a few guidelines on different symptoms that patients experience during cancer, whether it's neuropathy or insomnia or anxiety, or changes to their nutrition, weight, appetite loss, things like that. So yes, ASCO and SIO do have some guidelines, which are great.
All right, one more. It would seem that keeping patients feeling good while on therapy and managing side effects is financially beneficial from an insurance perspective to reduce things like emergency room and urgent care visits. You would think, right? But I think, like you were saying, Doc, it's the whole evidence. How are you? How can you sell this? Can you make a case for it?
Right.
Is it a nice to have, or is it, impactful?
Right.
That, and I think that's where the struggle is, right? Nice to have or impactful, especially because integrative oncology sounds so close to alternative medicine, right? Let's face it, which we know is a big no-no in the traditional space. It's a big no-no. Almost like if you try to even go think traditional, you're immediately like, called a heretic or be cut off. So I think integrative is a little bit more this side towards the traditional medicine. But how receptive have you seen just the healthcare practitioners to integrative oncology?
Yeah, well, first off, Peter's questions are fabulous. And you would think that insurance companies will see this as beneficial. And I think, again, it's going to take some time. But that's part of the reason why many of the integrative oncology programs around the country are actively doing research, mine included. So, we want to make sure that as we keep providing this type of care for patients, that we're making sure that it works. If it doesn't work, then we shouldn't be doing it, right? So there are many organizations that are committed to furthering the research here. But, to speak to your question, I actually find that most people are really open to it. I've had various people ask me, oh, Dr. Malani, like, where do how are patients referred to you? Most of my referrals come from medical oncology, honestly.
Okay.
So, I have a habit of always kind of connecting with the doc that I'm working alongside and wanting to make sure that they know what I'm doing and I know what they're doing. During my, training, I spent a lot of time in hospitals and training alongside medical oncologists because I wanted to make sure that I could speak both languages. I wanted to speak the integrative language. I wanted to speak the conventional language for my patients. So I find that at once there may be hesitation if they don't know what it means. And as soon as they find out what it means, they're almost always receptive because, again, the goal and I think the primary focus is that we put the patient first.
Right. I know, excuse me, I know that your dad experience with cancer and how he, as a doctor, and how he chose to live was part of your motivation. And I know that you mentioned that there's still research out there, waiting for the outcomes, waiting for the results, but just in your own personal experience outside of your father, just in your own practice, you're getting feedback from patients, right? So in your own research world, which is your own patients, what's some of the most positive things you're hearing about from patients who says, hey, what you recommended for me to do, whether it's like you just said, said something to me that I thought, bingo. You said breast cancer, patients, if they would just give themselves a 13-hour window, it's just going to be better for them. And like I was telling you about Dr. Mindy about the fasting, and it's taking what she said, which is a little bit more extreme, and you're saying, look, 13 hours, push your dinner down some more, your breakfast out a little bit more, rest your body a little bit. Don't snack so late. That's good advice. So maybe we don't know.
There's a great clinical trial on that.
Oh, okay.
Right.
So I love talking to people like yourself, doctor, because no, it's true, because this is the information that people desperately need. And so I really glad you're on this platform today. And for that woman, who's Peter's wife is also a survivor as well. Wow. So Peter, you could tell that to Julia, that 13-hour window is going to be helpful for that. But we learn this kind of stuff from doctors like you. We wouldn't hear this from our traditional doctor. And so, I mean, what has been like your and we'll end it with this, your greatest, like, all right, this woman's story or this person's story really kept me going, because I really what I'm doing just really impacting lives.
Gosh, there are so many. I think I am sometimes overwhelmed by the amount of gratitude. And I think many people in the integrative medicine space feel this, because we have the opportunity to truly connect with our patients and get to know them and know the names of their children and know where they work and really get to know them as humans. You develop you develop a relationship, and you're able to provide care through that relationship. And there's trust, and there's respect, and there's communication. And I think, gosh, I think a lot of patients have just thanked me for seeing them.
Yeah.
Right. Like for being able to see the person in front of me, not the statistic, not the diagnosis, not, what I see on paper. It's okay. Yes. It's just taking the extra few minutes to really get to know the person. And in terms of outcomes, I mean, I've already seen, I already have been seeing really good outcomes amongst not only my own patients, but many integrative oncology providers around the country. We're actively analyzing some of the data for a North American integrative oncology trial that was conducted amongst 12 clinics in Canada and the US. And, they're in the abstraction phase of their study, and we're seeing some good outcomes. The most crucial takeaway from what I've seen is that patients tend to fare better when they involve integrative oncology earlier in their diagnosis. So if you wait till the very end and you kind of go, you run out of options and then you seek out an integrative oncologist, and basically, is there anything that you can do that's not conventional? That's when we don't see great results, right? So if you can intervene and intervene early and get an integrative oncologist on your case at the time of diagnosis, that's really where the impact is.
Something you said, I want to end on this, because as you were talking, I'm thinking, just what Sarah said, your particular mannerism, right? Very caring. And like you said, it's a comparison. You said there's 23 minutes at a doctor's office. Some people say there's really 15 minutes, right?
Yeah.
So between 15 to 23 minutes is all you have your doctor. Mostly you're being scared. Mostly you're being told about something bad or a next pill or whatever. And then we come to the integrative oncologist and it's 45 minutes to an hour, right? And the patients are being seen. They feel seen and they feel heard. And I am just wondering if the intangible, if the unseen benefit of integrative oncology is just that, the fact that you're giving hope. I felt hope from my integrative oncologist, my doctors too, but she was also a survivor. She had gone through integrative medicine, and so she was a big believer and a big advocate for it. And just while you said it just now, it reminds me of this book I read. I'm going to end it with this. It was a medical book, and the doctor said patients who had the more positive thinking, who were more positive about their lives, about their outcomes, were the ones who actually fared really well. And I think just talking to doctors like yourself, that's going to be beside you on the journey, giving you ideas of how to sleep better or eat better or whatever you may say, is just giving us the inner fortitude, maybe the inner encouragement,
right,
to actually have our own bodies help to fight our own disease. And I think that's a wonderful place to be in service to people who are going through. And so we
are relational beings. I think we forget sometimes that relationships can be medicinal, whether it's our partner, our therapist, our whoever, our child. We are relational beings, and I think medicine is only able to be delivered if there is a relationship there.
Yes, and we're gonna end. This is called T Talks, right? T for the T cells. So we always give our guests the very, very last word. And I'm going to ask you this as your last word, because we didn't get a chance to talk about advocacy and patient advocacy. But you said earlier when we were talking, you said you give patients the tools, right, how to advocate for themselves better. So I just want you to talk to that patient right now who will be watching this in the replay at some point, and they're going to hear from you, and you're going to tell them how they can advocate for themselves or whatever it may be.
Patient advocacy in 2023 in this country is crucial, I find, from an insurance perspective, from a provider perspective. But I think it's really important to remember that when you are diagnosed and when you meet with your surgeon or medical oncologist, remember that you have the autonomy to pick your provider. If you do not feel like there is a therapeutic alliance, that's the term, therapeutic alliance, meaning there's an alliance that is going to provide some therapeutic benefit, then find someone else. You have that ability to get a second opinion. And I think it's really important that patients know that, and patients feel heard, and that they trust their intuition. If you're sitting in that room and there's this, feeling of heartburn or something going on in your stomach, and you're like, I'm in fight or flight and I want to get out of here, that's your body's signal. Listen to it. Find someone where your body's at rest and at ease, and you're able to kind of move into that parasympathetic, that rest and digest. Because when we're in these doctor's visits, our bodies do go into fight or flight sometimes. We can't think straight, right? So how are we expecting our patients to make really, really important decisions about their bodies and about, their treatment decisions when they're in a space of fight or flight? So I think it's really important for everyone to be able to have that alliance with their provider. And yes, if something is, everyone knows their body best, ultimately. I mean, we live in this thing 24/7. We know how it works. If something is off, advocate to get it checked.
Yeah. Good word. Very good word. Very good word. We'll end on that. If something is off, advocate to get it checked. Dr. Malani, thank you so much for being here and for sharing your knowledge and your time. We really appreciate the work that you do, and I wish you good luck in that project, because I'd love to see integrative oncology offered to many, many more people. So I see the benefit of it. I believe in it, and I believe in you. So
well, thank you so much. I really do just have I'm so grateful for a platform like this, and the type of information that you guys keep putting out, I think is really, really crucial for patients to have. So thank you.
Awesome. Stick around 1 second. I want to say goodbye to everyone in the feed, and we'll see you guys back here on Tea Talks next Monday. Take care, y'all. Bye.